Swadikap and good afternoon once again. Today is Wednesday, the 24th of March, 2021, and this is the English language summary of the daily press briefing here at the CCSA. So thank you to Dr. Apisamai just now who gave us the Thai language summary. Just some keywords. She ended with the words perseverance. That's what we need from everyone in Thai society. Perseverance. We've been facing pandemic fatigue actually for almost I guess almost a year or beyond a year already. It depends on how you count it. So that's still very important for us to keep our guard up and have the perseverance that we've always held strongly held close to our hearts. Now another keyword is of course about our two-way communication. In the past, we've been receiving many suggestions actually from both Thai and foreign nationals on various leading information, on various suggestions on how to improve the various impacts of the measures that we've been seeing. So it's very fine for everyone in society to suggest all of this to us, to be vocal in this, and we appreciate it very much because it makes us widen our perspective and able to adjust and become more flexible in terms of the measures and adjust the various practices and schemes and regulations that we have in order to best suit the situation and the context of Thailand, the ever-changing context of COVID in Thailand and around the world. So I'll start off first with the new confirmed cases, the numbers that we have recorded for today. So as you can see on screen coming up for you, we have 69 cases recorded for today, out of which 17 are from active case finding and 8 from abroad and the rest from local transmission. Now this number doesn't seem very high, but just of course you would see in the news that yesterday on Tuesday and perhaps some of the other days that we did not have the briefing, sometimes the numbers went up high. For example, yesterday, Tuesday, it was like around 400 plus new cases. Particularly that came from the immigration center, which I'll talk about that in a short while. So it is sometimes high because of the intentional active case finding that we have for each day. But today, recorded is 69. You can see on screen the current cases still being treated right now, still in hospital, is 1,381. And fatalities accumulated now stands at 92. Some observations from the briefing just now. Firstly is that this is the first time actually that the numbers of Bangkok, cases in Bangkok, found in Bangkok are higher than the number of cases found in Samut Sakhon province. So to put that in numbers, in Samut Sakhon, we have 9 cases recorded for today, but while in Bangkok it was 43. So this is the first time. Perhaps this is because of the measures, the strict enforcement that we have had, the various schemes, bubble and seal, if you recall, and all the active case finding missions in Samut Sakhon. So that has actually proven to be successful, and Samut Sakhon, in that province, the situation is now quite stable. So as compared to Bangkok is slightly getting more numbers now. There was also the first case of COVID found in a province that previously had no cases of COVID at all. If you remember the other day, I mentioned CCSA province as that particular province, that formerly they had 0 cases and now they have 1. Now, to report to you today, we have Nong Bua Lampu province, which previously in the past weeks and months had no cases, and now they have found a positive case due to close contact with a confirmed case from Bangkok. So it's actually from the cluster in Bangkok and someone who had traveled from Bangkok to Nong Bua Lampu province. In terms of vaccines, the vaccine arrivals have been ongoing. The other day I mentioned about the arrival of the batch of vaccines numbering 800,000 doses. And that batch of vaccines have been distributed to up to 22 provinces around the country already. And these 22 provinces include provinces in the border areas of Thailand with our neighboring countries. Because as you know, border trade is very frequent. It's It's happening all the time. There's a lot of people involved. It involves boundary travel as well. So therefore, it's very important, and that is why exactly our focus has been on vaccinating people in the border provinces of Thailand with our neighboring countries. Now, Dr. Pisamai also mentioned about the infections, the cases in the Immigration Bureau's detention center. So yesterday, the Ministry of Public Health reported a high number of confirmed cases, which might have caused some alarm since yesterday. Around 400 plus cases were recorded yesterday. The CCSA we have to clarify that most of the cases were found in the detention center in Bang Khen and in Suan Plu within the detention centers. And of course, these positive cases have not been in contact with the general public. So according to the Department of Disease Control, nine individuals detained in these centers first tested positive for COVID-19 at the Bang Khen detention facility on the 11th of March 2021. And the remaining cases were found through subsequent efforts of active case finding. Now, this number is 393 infected persons found in these detention centers. And I guess a few others were found outside these detention centers. That's why the number is 400 plus yesterday. So out of most of these 393 infected persons were asymptomatic, no symptoms or had mild symptoms, and they were immediately isolated and have been treated in hospitals according to our protocol, or hospitals or at the newly set up field hospital at the stadium of the Royal Thai Police Sports Club on Vipawadi Rangsit Road, which could accommodate up to 300 patients at one time. And for the time being, the Immigration Bureau's detention facilities in Bangkok were closed to new detainees. So they won't be receiving new detainees. Detained illegal migrants who were free of COVID would be transported to the Ministry of Social Development and Human Security's facilities instead. The Public Health Ministry assures that the situation with regard to the detention center is under control, and the positive cases have not been in touch with the general public at all. All persons being treated in the same standard practice as with others, the general population outside the detention center if found positive. And they will be tested to ensure that they are COVID-free before being released from the healthcare facilities. Just additional update on the situation in general. During the CCSA meeting yesterday and today this morning, the daily meeting, the Deputy Provincial Governor of Samut Sakhon reported that the health authorities have continued to conduct active case findings, around 1,500 to 2,000 active case findings per day. However, only 3 cases have been found from active case finding yesterday, which indicate that the situation in Samut Sakhon has significantly improved. And as I mentioned, the number in Bangkok now per day is higher than the one in Samut Sakhon. And later this month, the province will receive another 100,000 more vaccines and will continue to inoculate people in the high-risk groups to rid the province of COVID once and for all. Now, for public transportation, that will resume today for Samut Sakhon. The governor of Prachuap also had a video conference with the CCSA meeting today. And to mention about the Bang Khun Thien district in southern Bangkok, 17 workers were in a bread factory in Bang Khun Thien district were found to be infected lately. So the initial carrier of this small cluster in Bang Khun Thien was a migrant worker who was tested during the process of extending the work permit. and all high-risk persons have been immediately tested and isolated as a result. So the CCSA would like to assure that the situation is being closely monitored, be it the cluster in Bang Khun Thien in Bangkok, our success in Samut Sakhon, and in other areas, the border provinces of Thailand and the like. So the Prime Minister has reiterated that the relaxation of disease control measures will continue to allow more businesses to be opened. And therefore, we'd like to urge the public to remain vigilant in practicing DMHTT to prevent the further spread of the virus. So basically, this is what I have for you, just a recap of the summary that Dr. Apisamai had briefed to you just now. Just before closing, just to wrap up in terms of the international travelers who have entered Thailand since last year. As you recall, travel around the world was halted since last year. It's being opened gradually in many countries around the world. In Thailand, we have had that. So today, I can say that we have reached a benchmark in terms of international arrivals in Thailand, particularly foreign nationals, not including Thai nationals, who have been repatriated back. So for foreign nationals, a benchmark for today, because the Ministry of Foreign Affairs has issued up to today more than 100,000 certificates of entries, COEs for foreigners already. To be exact, I think around 100,700 or 101,000 within that number plus minus up to today of COEs issued for foreigners. And from this number, there are, of course, many categories, many types of visitors. Those who have work permits and you know all of that. Foreign nationals with foreign students, foreign nationals with Thai families, tourists, those with other special tourist visas and the like. But of this number, 100,000 plus COEs, around 16,000 were actually categorized as tourists. So you see that the number is not very high, but there are entries of foreign nationals, but particularly for as tourists, tourists per se, it's not very high. So we hope to see this number of visitors increase in due course as the government is preparing to relax the quarantine measures starting on the 1st of April next month, as we have talked about already. Relaxing measures, the number of days of quarantine from 14 to 10 days for those arriving in the country, and for those arriving in the country not coming from countries with the variant strain of the virus. So we'll be working on that vigilantly. And as well as with other relaxation measures as we move towards more normalcy. So thank you very much. Thank you very much for your kind attention today. It's very important that we communicate two-way. If there's any suggestions or any proposals that you have, you can, of course, inbox us through various social media platforms. That's also available in English as well, at least the Foreign Ministry and the CDC hotline and the like. So thank you very much. We'll see you again on Friday. สวัสดีครับ